Question number 1. A patient diagnosed with diabetic ketoacidosis. The nurse enters his room to check his vital signs and document that he is breathing at a rate of 32 breaths per minute. His respirations are deep and regular. Which type of respiratory pattern patient most likely exhibiting? Options: Option A, small respirations, B, chin stroke respirations, C, Biot's respirations, and D, cluster breathing. So here the right answer is option A, small respirations. The small respirations may be associated with some conditions such as metabolic acidosis. So this type of breathing is actually a form of hyperventilation resulting in increased buildup of carbon dioxide in the body. Small respirations are typically rapid, regular, and deep. Question number 2. A nurse is educating parents about preventing sudden infant death syndrome. Which instruction should the nurse include? Options: Option A, place the baby on the stomach to sleep. B, use soft bedding in the crib. C, place the baby on the back to sleep. D, overdress the baby to prevent chills. So here the right answer is option C, place the baby on the back to sleep. So placing the baby on the back to sleep is a key recommendation to reduce the risk of SIDS. The soft bedding, stomach sleeping, and overdressing are risk factors for SIDS. Question number 3. Which of the following defense mechanism is expressed by overachieving in one area to make a for lack in another area? Options: Option A, compensation, B, displacement, C, suppression, and D, repression. So here the right answer is option A, compensation. So compensation is a defense mechanism where individuals overachieve in one area to compensate for perceived deficiencies in another. It allows them to bolster self-esteem or cope with feelings of inadequacy by excelling in a different domain. So this mechanism helps to maintain a sense of competence and control despite shortcomings in specific areas. Question number 4. A patient with severe asthma exacerbation is admitted to the emergency department. The nurse assesses the patient and notes that the patient is wheezing audibly, has a respiratory rate of 28 breaths per minute, and is using accessory muscles to breathe. Which of the following is the nurse's priority interventions? Options: Option A, administer a prescribed bronchodilator via nebulizer. B, obtain a blood gas sample. C, initiate continuous pulse oximetry monitoring. And D, place the patient in a high Fowler's position. So here the right answer is option A, administering a prescribed bronchodilator via nebulizer. So administering a bronchodilator addresses the airway constriction directly, providing immediate relief and improving breathing of the patient. Question number 5. A nurse is caring for a pediatric patient with a severe peanut allergy. Which is the most appropriate immediate intervention if the patient is exposed to peanuts? Options: Option A, administer dihydramine. B, administer epinephrine. C, administer albuterol. And D, administer hydrocortisone. So here the correct answer is option B, administer epinephrine. So anaphylaxis, that is due to peanut allergy, is a medical emergency and requires immediate administration of epinephrine to prevent severe allergic reaction and possible death of the patient. Question number 6. A nurse is caring for a busy woman with 4 children who report not having slept through an entire night for more than a week because several of the children were ill. The nurse attributes which of the following behaviors to the woman's lack of sleep? Options: Option A, sitting quietly in the waiting room reading a book. B, acting irritable with the receptionist. C, pacing in the waiting room. D, talking on the phone with the babysitter. So here the right answer is option B, acting irritable with the receptionist. So lack of sleep can lead to irritability and mood disturbances. Therefore, the woman's irritable behavior with the receptionist may be attributed to her lack of sleep, that is due to her children's illness and her consequent sleep deprivations. Question number 7. A patient with a history of deep vein thrombosis is receiving warfarin. The patient INR is 1.2. The nurse should anticipate options. Option A, administering vitamin K. B, holding the next dose of warfarin. C, increasing the dose of warfarin. And D, continuing the current dose of warfarin. So here the right answer is option C, increasing the dose of warfarin. So an INR of 1.2 is below the therapeutic range, indicating the need of increase the warfarin dose to achieve proper anticoagulation. Question number 8. Which of the following classes of drugs commonly ends in pain? Options. Option A, calcium channel blockers. B, angiotensin converting enzyme inhibitors. C, anticoagulant. And D, beta blockers. So here the right answer is option A, calcium channel blockers. So drugs ending in pain predominantly belongs to the class of calcium channel blockers. These medications inhibit the influx of calcium ions into the cardiac and smooth muscle cells, resulting in vasodilation and decrease the cardiac contractility. By blocking the calcium channels, they help to lower the blood pressure and treat the various cardiac conditions such as hypertension, angina, and certain arrhythmias. Question number 9. A school-age child has been diagnosed with attention deficit hyperactivity disorder. Which medication is typically prescribed for managing symptoms of ADHD? Options. Option A, diazepam. B, methylphenidate. C, lorazepam. And D, fluoxetine. So here the right answer is option B, methylphenidate. So methylphenidate is a stimulant medication commonly used to manage symptoms of ADHD such as impulsivity, hyperactivity, and inattention. Question number 10. Which nerve provides sensation to the skin over the suprapubic area? Options. Option A, superior hypogastric plexus. B, iliohypogastric nerve. C, ilioinguinal nerve. And D, pudendal nerve. So here the right answer is option B, iliohypogastric nerve. So the iliohypogastric nerve passes medial to the anterior superior iliac spine in the abdominal wall. It enters the anterior abdominal wall to supply the skin of the suprapubic area at a site 2 to 3 cm medial to the anterior superior iliac spine and then courses between the layers of the rectus sheath. So it is at risk of entrapment when closing a low transverse incision. Question number 11. A patient with clouding kidney disease is receiving erythropoietin. A nurse knows to monitor for which of the following adverse effects. Options. Option A, hypotension. B, hyperkalemia. C, thrombosis. And D, hypoglycemia. So here the right answer is option C, thrombosis. Erythropoietin can increase the red blood cells production and raising the risk of thrombosis for the patient. Question number 12. A patient is diagnosed with hypovolemic shock. As a nurse, you know that the signs and symptoms of hypovolemic shock are all of the following except options. Option A, tachycardia. B, hypertension. C, pallor and cyanosis. D, trachypnea. So here the right answer is option B, hypertension. In hypovolemic shock, that is characterized by a decrease in circulating blood volume. Therefore, hypertension is not typically as a sign or symptom of hypovolemic shock. Instead, hypovolemic shock typically present with signs and symptoms such as tachycardia, pallor, cyanosis, and trachypnea. Question number 13. A patient with increased intracranial pressure is being treated with mannitol. The nurse should monitor for which of the following as a priority. Options. Option A, pulmonary edema. B, hyponatremia. And C, hypokalemia. D, hypotension. So here the right answer is option A, pulmonary edema. So mannitol is an osmotic diuretic. It can cause fluid shift, potentially leading to pulmonary edema as a serious complication.